So, cardiac tamponade, it is potentially a fatal condition. It causes ventricular diastolic filling pressure to be increased and intrapericardial pressure because there accumulation in the pericardial fluid. Usually 30 to 50 ml of pericardial fluid is present, but it is more than that, which causes the sign and symptoms of hemodynamic instability. The classic triad of cardiac tamponade is muffled heart sounds, hypotension, and raised JVP. The most common causes of cardiac tamponades are it can be pericarditis. In our population, in the developing world, it's tuberculosis. It can be iatrogenic, trauma related, or neoplasm or malignancy. Patient can be hemodynamically unstable, and in the physical exam, the classic backstride is already mentioned. The first initial test is bedside imaging, transthoracic echocardiography. If it is equivocal, then you can go for transesophageal echocardiography. Transthoracic echocardiography is class 1 recommendation according to ESC guidelines 2015, and so what you are going to see in right atrial diastolic collapse. This is, you can achieve that in parasternal short axis or subcostal view. It is highly sensitive but less specific. Around 80% it is specific. You can also see RV early diastolic collapse, which is more sensitive and specific, but it is poor sensitivity in surgical patient. RV early diastolic collapse can also occur before the sign and symptoms of in the patient. Now, the most specific sign in the transthoracic echo is left atrial diastolic collapse, but it is rare. You can also get IVC plethora, and there is abnormal inspiratory increase in the RV dimension and decrease in the LV dimension. You can also go for the CT scan or MRI. These are the advanced imaging if there is echo-vacuum or post-surgical, or there is loculated tamponade or fusion. Now, the class 1 recommendation is to do echo. You can have urgent pericardial centesis and cardiac surgery. It is again class 1 recommendation. And there is class 3 recommendation to not to use diuretics or vasodilator therapy.